The best advice that I can give to a new pregnant mom is to remember that pregnancy, the entire experience is about expecting the unexpected and becoming comfortable with surprises. 9 times out of 10, the experience is not always what you anticipate it will be, but knowing that you can trust the people who are caring for you can bring you a whole lot of comfort. And reminding yourself that in the end, the only goal is a happy, healthy baby and a happy, healthy mom. And it doesn't matter how we get there. My name is Labeena Wajahat. I am one of the OBGYN physicians at this practice. A typical day in my life here at the office usually starts right around 7:30 most days. So I get here right around the beginning of the day, and my patients are usually in their office already. My MAs are wonderful. They do a really, really great job at helping me out throughout the day with anything that I need. Once it starts, it's usually go, go, go until the very end of the day, right around 2:30 or 3 o'clock. Typically our new OB visits or the very first visit that a patient who's pregnant has at our practice is a bit of a longer visit. They'll come in for their ultrasound the morning of that appointment, and so they'll get some nice pictures of their baby, first trimester typically, and then they come and they meet with me, their provider. So I'll start off by telling them, their due date and go review the ultrasound that they've had done with them. I'll go over their medical history and surgeries that they've had in the past before, and their pregnancies, if they've had pregnancies in the past as well. Kind of similar to treating it like their annual exam if they haven't had one already that year. We'll do a full exam and catch them up on their pap smears and their routine health maintenance. The experience that I had in medical school was what drew me to the specialty in the first place. So I very much cherish the relationships that I get to develop with my patients, especially through their pregnancies and even afterwards for their postpartum experience and throughout the rest of their lives, really. For a lot of patients, their OBGYNs are their primary care doctors because they don't often need to see someone until they're pregnant or they have any concerns in regards to their women's health. It's very important to me when I meet them for their first visits and their pregnancies to orient them to our practice and to orient them to me as well, and make sure that they have all of their questions answered and addressed, and they feel like they can trust me because it's a two-way street, and that's really important to me. I was very blessed to grow up in a family of physicians, and so both of my parents are doctors as well. They did their training in the Midwest, but went to medical school in Pakistan, where I'm from. I grew up around that influence, and I always knew I wanted to be a doctor, but wasn't quite sure what I wanted to pursue specialty-wise. But I had a very, very amazing mentor in medical school who was an OBGYN, and it was maybe my 3rd or 4th rotation in my 3rd year of medical school, and I had gone through several other specialties that I liked, but there was something missing. And when I got to OBGYN, it had the bits and pieces of everything that I liked before. I wanted to be kind of like a jack of all trades, and so OBGYN was where I found that, and I've never looked back.
I assume once a mom and family gets comfortable, they come back, right? And so you see a lot of the same faces.
I beg them a little bit. I'll say, you're not done with me yet. You'll have to come back and see me for your annual and bring me pictures. Or the baby, that works too. Yes, I love seeing them back.